And we're back. Welcome to Coffee Talk with Mike and Janelle. We are on episode 13. And today we want to talk about something very serious that probably does not get enough attention. But we really wanted to bring to light about the leading causes of death for autism, because these guys are 2 times more likely to die younger than their counterparts, on average 36 years younger, which is pretty staggering. So why is this? What are the leading causes of death in our research and our findings? It's most likely due to suicide, seizures, and to accidental death, such as drowning.
Yep.
So did you want to chime in a little bit here?
Yeah, I mean, it's a really, it's a little bit more somber of a talk. I mean, obviously, we hope that all Coffee Talk episodes are relevant and important to the families that we serve and our colleagues out there working in this field. I personally was, kind of surprised by this information, and it was only a couple of years ago. I mean, we've been doing APEC for 6 years, been working with developmental disabilities for well over a decade. But it was striking to me and to my psychiatric colleagues that when you mention something such as, I think people know, 1/3 of the population with autism has seizures, and we'll talk about that in a second. But really, the rates of death by suicide, we know drowning is a concern because we see it in social media all the time, or in newspapers, and tragedies that happen around the country literally on almost a daily basis. But it's really important, and I think hopefully what we can highlight a little bit here is, one, awareness, but also a lot of these tragedies are really deemed avoidable. And so hopefully this will be a bit of an awareness for folks, and maybe some concrete steps that they can take to improve the safety for the ones that they treat or the loved ones in their family.
So let's start with epilepsy. Folks we know with autism are more likely to have,
about 1/3 of all people with autism will have a seizure disorder.
And folks with a history of a seizure disorder are 20 times more likely to die suddenly.
Yeah. It's a huge, and particularly people with cognitive deficits as well. It's even a larger risk of dying from some neurological related episode. And epilepsy, seizures can be everything from a febrile seizure or absent seizures with a stirring spell that may go away just as you get older, to full blown, grand mal, tonic-clonic seizures, and everything kind of in between. And there is a lot of morbidity associated with seizures. And death is very commonly associated with asphyxiation, maybe a cardiac arrhythmia, an aspiration pneumonia where someone throws up while they're having a seizure. But then there's also a whole large group of kind of sudden death, seizure-related sudden deaths, where there's no other known etiology, and it happens often during sleep. It's a very scary moment for families, right? I mean, how many families do we have that simply won't take a shower unless there's someone else in the household in case their loved one has a seizure? Their child can't be in the bathtub unsupervised for even a second. Another worry, being around pools, being on ladders, but any kinds of things that can result in falls going downstairs. So it's a very common concern.
Yes.
But there's things that you can do to lessen that risk. In the studies that we've looked at of the deaths related to seizures with people on the spectrum, they estimate that close to 40% are potentially avoidable. Potentially, not to say it was someone's fault that happened, but the steps that could have been taken that may lessen that risk.
So in general, talking about prevention, obviously there's some common threads here. Take your medication as prescribed, as dosed. Talk to your provider about side effects, what's effective, what's not effective, what's beneficial, all of that. It's important to get enough sleep, watch your diet, track your seizures. What are your triggers? What other things would you suggest?
Well, in other episodes we've talked about the importance of risk and benefit of medication. So for instance, a lot of people with autism, if you've watched prior episodes, you'll know that there's a huge amount of use of antipsychotics, for instance, with people with autism, either for autism itself or comorbidities. Some of those medications lower the seizure threshold, making it more likely to have a seizure. Doesn't mean you don't use those meds, but it's really that comprehensive plan. And again, it comes down to who's taking care of your seizures, who's taking care of your psych meds, who's the person kind of coordinating all of it together. Ideally, your primary care doctor, so that there's a real plan. So the psychiatrist, the PMD, the neurologists are all working kind of in concert to minimize risk for seizures, minimize your risk for other things and do it in a complementary way. A lot of meds that we use for seizures affect the metabolism of other medications, or their metabolism is affected. So it's really just having a plan. And then there's just general seizure awareness and safety planning. Like, what do you do if a loved one has a seizure? What's the best way to position them? What kinds of things can you do? There's a lot of technology coming out now that potentially, if not predict a seizure, I don't think we're there yet, but can alert people at the onset of one. So you don't necessarily have to have eyes on every second, but you can have an alarm, so okay, now we have to go to room A in our house because this is going on. There's even some use and very expensive and still needs some more research, but service animals,
Yes.
that can predict seizures, or if not predict seizures, help align the individual in a safe way, go for help. I mean, there's all kinds of different training things.
I've seen dogs lay down so the individual, can't bang their head on the floor.
Exactly.
And that sort of thing. It's quite impressive.
Yeah,
and
so there's a lot to do. The first thing's awareness,
yes.
right? Awareness, talking with your healthcare providers, having a plan that everyone in the household or the group home or whatever the living environment is aware of, knows, and ideally then, we can, if not reduce, we can't reduce the incidence of seizure disorders in people with autism, but we potentially can reduce the bad outcomes associated with them.
For sure.
Yeah.
So the next thing I wanted to chat about is suicide, and most folks probably don't really coincide suicide and autism,
Yeah.
but unfortunately it's very common. They're 10 times more likely than their peers to commit suicide.
And those are neurotypical individuals
Yes.
with no cognitive deficits that are 9 to 10 times more likely to attempt and complete suicide. It looks like it's even higher for individuals with cognitive deficits. It's just very hard to measure because the intent of an action is a little bit hard to predict for someone who has few or no words.
Yes. And sometimes, and to be honest, as recently as today on a consult, we had a parent say, well, our son's made suicidal statements, but we don't suspect that they'll ever be followed through. And it was refreshing to hear the other parent say, well, you just don't know that, because it's true.
Yeah.
All of these statements should certainly be taken seriously.
Well, I would argue that when someone says they're suicidal, regardless of what their cognitive status is, regardless of what their, whether they have a neurodevelopmental disorder, whether they have an underlying psychiatric condition, the word suicide gets treated very seriously. To me, as a physician, it's like someone saying the left side of my chest hurts.
Right.
That's a heart attack until
Yes.
proven otherwise. And it can be challenging because people can use the word suicide frequently for a lot of purposes. But when someone is voicing suicidality, to me, that's one step away from a psychiatric emergency, if not a psychiatric emergency. When it's someone with autism, their rates are so much higher.
Exactly.
And people will often say things like what we're discussing today. Someone will discuss, well, he doesn't really understand the concept of death and dying. That's not protective in any way, shape, or form. There's a lot of things, but I think the thing that was most striking to me when we first started looking at this clinically, 7, 8 years ago, was not only is the risk higher in the ASD population, but the means are not necessarily any different.
Right.
I mean, you don't think of a nonverbal individual committing suicide by hanging, but that in fact happens with some level of frequency.
Yeah.
So it's being aware, it's having a plan, certainly for someone who is verbal, who's cognitively kind of more on average. We're going to use the same screening tools that we would use for a neurotypical population. However, we may have to factor in things about what is their understanding of reality, what is their understanding of death and dying, what is their, protective factors are often having close relationships with people, and that may be a little bit more complex in this population. For people who are nonverbal and people with moderate to profound intellectual disability, it's not like there's great screening tools out there for it,
Right.
So I think at minimum, as professionals, as families, you have to be on the lookout.
For sure.
You have to be aware that this is not just a possibility, but a much higher possibility in your child than in someone's child who doesn't have autism. And that's at least the first step.
You're going to look for the signs and symptoms. They're going to be isolating. They're going to be sleeping more. They're not going to be eating. They're not going to be engaging in activities that they normally would. And, folks wonder why do people on the autism spectrum have a higher likelihood for suicide? And if you think about it, I mean, they're more likely to be bullied. They
Huge
cannot,
trauma histories.
usually a huge trauma history for sure. They're not always able to verbalize how they're feeling or process events. They don't always have the ability to engage socially. They may already be just isolating or not have that human interaction as their peers would. Um, their lifestyles are typically more stressful. They're
Well,
anxious.
and a couple years ago in the modern media, there was a lot of conversation about loneliness. They're talking about loneliness and
Yeah.
social media and things like that. But one of the striking things from that set of studies was that loneliness, at least as it was defined in the study, was a larger risk factor for mortality of any cause than heart disease was. And so when you think about someone on a spectrum who may be socially isolated, maybe they've transitioned from school to adult services, which is always difficult. Maybe they've had loss of parents or other loved ones. Mm-hmm. They have other sources. Many of the folks, most of the people who've completed suicide, at least within studies who have autism, also about 90% of them had a comorbidity, a psychiatric diagnosis that is potentially treatable, whether it's depression, anxiety, bipolar disorder, PTSD. So yeah, they are at exquisitely high risk, and yet the risk can't be turned to zero. Mm-hmm. But awareness, screening, treating comorbidities, creating opportunities to decrease social isolation, all these things are really important. They're important anyways, but when we're talking about suicide, are of particular importance.
And I think COVID has certainly, across the board, really isolated a lot of people and made people lonely and distraught and stressed in fear of the unknown and anxious. Yeah. So it's pertinent to discuss that now. And so the last topic I wanted to chat about was, accidental deaths such as drowning, which is very common with our autism patients that we work with. And it's unfortunate because they are drawn to water because it's very sensory. They're seeking that visual input with the reflection on the water,
shimmeriness,
the sound of the water, the waves. Some really like the sensation of being submerged or just the wetness. And unfortunately, a lot of folks on the spectrum tend to wander or elope.
Yeah, up to 50% of individuals. I mean, I think it's about 50% of individuals on the spectrum elope and wander, significantly higher than their non-autistic peers. Mm-hmm. When you look at numbers, surveys of parents, about 2/3 of parents of an autistic child say there's been a very close call with a traffic issue, child wandering into the street.
Yes.
About 1/3 have said they've had a really close call with drowning. So you start thinking about 154 kids, 2/3 of whom have had a risky episode in traffic, and 1/3 of whom have had a close call for drowning. This is as much of a public health issue as almost anything we deal with, particularly with individuals with autism.
One statistic I read, it was an astounding 160 times more likely for an autistic person to drown over their peers.
Absolutely.
That's insane. So we need to be mindful again and be aware. And I know things that we've talked about previously with folks that wander is getting those locks on the doors, making sure there's alarms, have the tracking devices.
And the technology for those tracking devices has gotten so much better.
Yes.
It used to be you had to have this giant thing. It was almost like you're on home arrest kind of thing, and to lock on the ankle and stuff. But they're getting better and better with RF technology, with other things. Still not a perfect solution, but can be really not just life-saving, but also financially approachable by most families. It used to be these were either donated technology or $800-$900, whereas there's some pretty good solutions out there for like $30.
And we've had folks too who, they can't tolerate the sensation of the watch or the clip or whatever it is, the tracking device. So, if they have a cell phone, we can track the cell phone. Yeah. A lot of our teens, aren't going anywhere without their phone. So that's another thing. And I just wanted to briefly talk about the ID cards too, because I feel like it's important, especially for our nonverbal folks.
Yeah.
If they have their information, their demographics, their contact information, indicates what their triggers are, that they are on the spectrum, please do this, please don't do this. That's also helpful if someone would be lost or, you know, can't find their way back home.
Well, and this is also a situation, particularly with the drowning, that they that we can really be proactive in a pro-healthy way, right? So you know, water safety, swim lessons. I went to college at Cornell University. There's a lot of people who go there who don't know how to swim. There's a lot of gorges that people go down and paddle around in the water. The very first thing we had to do during orientation as college students, the very first thing, was take a swim lesson.
That's so smart.
Swim test. And if you couldn't pass the swim test, you were automatically enrolled in swim class, mandatory, as a college freshman. And so you start thinking about those things. I mean, swimming and being able to swim, even if it's not something you enjoy, is a skill that would be nice for everyone to have. And in this condition, it could be 100% life-saving.
Yeah.
So those are the kinds of things. And there are swim classes for people of all cognitive abilities. I mean, it may be a little bit harder to find in all ages.
Absolutely.
And so it's one of the probably most proactive steps that a parent could take with an autistic child is make sure that they have some ability to have safety around water, and some ability to swim. Obviously, that doesn't, you know, once we're in the water, we've already kind of, you know, we've got the elopement issue, we got the supervision issue, we got the tracker issue, all these things. But in the end of it all, I mean, you know, there's probably not a day, you know, social media follows what you open up, and there's probably not a day, certainly not a week, that I can't go on social media and not see some tragedy across the country of a child or adult who wandered away and succumbed to either the elements or drowned.
Yeah.
And so, and they're not all preventable, but this is something that we really can really do a lot to reduce the morbidity and mortality associated with autism just by the awareness, but then the next step, that proactive step that the family and treatment team take to reduce the risk.
Yeah. So I think that was our goal today, folks, is really just kind of bring everybody up to speed of the realities that we don't always think about or talk about. So the key is really about being aware and knowledgeable and educated and being mindful of these things and how we could really take simple steps to try and prevent them.
And a lot of parents in the communities that we work in get more of their information from other parents than they do from professionals. So this is important where parents can share some of the skills and life lessons that they've learned with other parents or maybe newly diagnosed individuals that they may come across in schools or after school programs or social community groups or whatnot. You know, I mean, it's certainly it's a sobering topic today, but it's not one that doesn't have a potential good outcome. You know, that there are really tangible things that we can do as family members, as professionals, to greatly diminish you know, the risk of dying or having a bad outcome from epilepsy, from wandering, from suicidal behaviors in this population. And so, you know, hopefully this is helpful to people and will be something that they're thinking about during this journey of life that we all go through.
Yeah. So keep your eyes open, folks, and take care of each other and yourselves.
Absolutely.
Until next time.
APEC out.
APEC out.